Minister, we're ready to begin. Please go ahead.
Thank you very much. Welcome to everyone, and thank you for joining us this afternoon. As people are no doubt aware, Health Canada recently approved a vaccine for the 5 to 11-year-old group, and we're here to talk about what that means for the province. We are expecting our first deliveries of vaccine within the next 48 hours, and our proposals, our plan will roll out over the coming days. So to start, on the panel, I'm joined by Dr. Fitzgerald and Dr. Bridger, and I'll hand the microphone over to Dr. Fitzgerald in the first instance. Thank you.
Thank you, Minister. Good afternoon, everyone, and thanks for joining us today. I'm so very happy today to be able to speak with you about our COVID-19 vaccination program for children aged 5 to 11. I'm also very pleased to welcome Dr. Natalie Bridger, infectious disease physician, pediatrician, and clinical chief of infection prevention and control with Eastern Health, for joining us for this very important announcement. As you are aware, last Friday, Health Canada gave official approval of the Pfizer-BioNTech Comirnaty COVID-19 vaccine for children aged 5 to 11. This means that the vaccine is considered safe and effective for children in this age group. Pfizer's clinical trial showed that the vaccine was 90.7% effective at preventing COVID-19 infection in children ages 5 to 11, and no serious side effects were identified. The immune response in children 5 to 11 years of age was comparable to the immune response in those 16 to 25 years of age. This vaccine will be a 2-dose regimen of 10 micrograms to be administered 8 weeks apart. This is a lower dose than what we offer to those aged 12 and older, and that's because children really have a more robust immune response than adults and often require lower dosages of vaccines. It's not really based on physical size. As a precautionary measure at this time, it's recommended that children not receive the COVID-19 vaccine within 14 days before or after another vaccine. Whenever a new vaccine is developed, we want to observe for potential side effects as part of our vaccine vigilance program. Separating the COVID-19 vaccine from others makes this clearer in the initial phase of the vaccine rollout. And indeed, in the initial rollout of our adult COVID-19 vaccine program, we had similar recommendations. We have been notified that the first shipment of the pediatric vaccine will be arriving in our province within the next 24 to 48 hours, and we expect the remaining shipments by Friday. We will then have enough supply available to administer first doses to all eligible children in the province. The vaccine will be available to children both in schools and community clinics, and parents can choose which option works best for them. Minister Haggie will speak to the specific details on the rollout shortly. Parents can also visit our website to see our immunization plan for children. There are about 35,000 children in Newfoundland and Labrador eligible for the vaccine, and I strongly encourage parents and guardians of children in this age category to make the choice for your child to be vaccinated. There are a multitude of reasons why vaccination for this age group is important, and while children with COVID-19 usually have milder symptoms than older individuals, it is still a very serious disease that can cause severe illness regardless of age. There have been no pediatric hospital admissions due to COVID-19 in our province. However, other jurisdictions with overall higher case rates of COVID-19 have seen an increase in cases and more severe illness in children associated with the Delta variant. Additionally, offering the vaccine to this age group will not only protect children from infection, it will help prevent the spread of the virus to others, such as family members that might be at higher risk of complications of COVID-19 infection. It will also strengthen our overall barrier against COVID-19. Modeling indicates that we need to have about 90% of our total population fully vaccinated to safely return to Alert Level 1 and remove public health restrictions. Expanding eligibility to school-aged children will help bring us nearer that level of population immunity we need. Finally, and importantly, we know that in-person learning is essential for the health and well-being of children. Brisk uptake of the COVID-19 vaccine in this age group, as we have seen for other vaccines, will decrease the risk of school closures due to COVID-19 significantly. Newfoundland and Labrador has traditionally led the country in uptake for childhood vaccinations, and I am very optimistic that this pattern will extend to the COVID-19 vaccine. As I've indicated before, barring any new and unexpected developments, this is the last major hurdle we need to get through in the COVID-19 marathon. Over 432,000 people in our province have made the choice to be vaccinated. If you are a parent, please make the choice to vaccinate your children against COVID-19. Thank you, and hold fast, Newfoundland and Labrador. And I'll now turn it over to Dr. Bridger for her remarks.
Good afternoon, and thank you so much for the opportunity to be here on this fantastic day. In my career as a pediatric infectious diseases specialist, I've seen firsthand the benefits of childhood vaccines. In Newfoundland and Labrador, we no longer have to worry about our children becoming paralyzed by polio. We almost never see cases of measles. We don't see babies being born blind from congenital rubella anymore. This is all because of vaccines. And I'm delighted that we can now add COVID-19 to our list of vaccine preventable diseases. The direct and indirect effects of the COVID-19 pandemic on our children are unparalleled. And while many parents and caregivers are excited about this latest development, I understand some may have some reservations, particularly around vaccine safety. I am confident that these vaccines are safe, effective, and high quality. I hope in the coming days, you will get answers to your questions so that you will be empowered to make the best decision for your child and family so that we can all move forward safely together. Thank you.
Thank you very much, Dr. Bridger, and thanks for taking time out of your day to join myself and Dr. Fitzgerald. So yes, the vaccine for children is coming. It could be here as early as Wednesday night with the first shipment. And as Dr. Fitzgerald referenced, we have sufficient orders by the end of the week if the deliveries arrive on time, weather permitting, to put a shot in the arm of every child between the age of 5 and 11. The vaccine rollout will be operationalized as usual by the regional health authorities, but on this particular occasion, it will also be in conjunction with the school district and the Department of Education, and I'd like to thank them for their efforts in facilitating this rollout. So as far as the schools are concerned, parents will get a letter electronically by their usual means within the next 24 hours about the vaccine rollout, and then there will be reminders starting next week. There will be a presence in schools next week, and that will be again announced through each of the regional health authority websites as to which schools on what days. From the point of view of the mass vaccination clinics, and indeed in some of the smaller communities, they may actually be the schools out of hours and at weekends. But in terms of the mass vaccination clinics, they will be available starting, all being well, the 27th of November. Appointments for these, and you will need an appointment, can be made by going to the website, the government website, and it's the Get the Shot page. And when you're filling that in, it is important, however, to look for the box that says 5 to 11-year-olds, not the general COVID vaccination box. This will make sure that you are directed to clinics where there is pediatric vaccine and sufficient numbers for your child. So if you choose that route, it's really important that that piece is indicated when you register for your appointment. Obviously, in schools, the vaccine will only be the pediatric one unless it's out of hours, and that is the site of a mass vaccine clinic. From the point of view of just repeating what Dr. Fitzgerald said, NACI have recommended that children do not receive a vaccine for flu, for example, or any of the usual childhood vaccines, 14 days either side of their COVID shot. In terms of adults who are looking for flu shots at the moment, in order to help public health concentrate on the children's vaccine rollout, I would actually encourage you to use your local pharmacy or your family family physician, primary care provider, to get your regular flu shot. That would help spread the load a little bit and allow public health to concentrate on the children. I'd also like at this particular moment to thank public health again for really kind of looking at the playbook differently and being flexible to allow us to offer as convenient a range of options for children and their families to get their COVID shot. We certainly know that we can get really good numbers with mass vaccination clinics, but we've seen that to get the really high numbers that Dr. Fitzgerald has recommended, the 90%, we actually had to go and look at the convenience factor. And I think this range of options with where children and their families can go for the COVID shot at this stage will actually help the rollout. There's certainly been a lot of interest, and indeed we had to issue a release last week saying please don't try and book 5 to 11-year-old appointments at that stage because this wasn't available at that point. The website should be up and running by the time this news conference closes. So with thanks to those involved and a real appreciation for all the hard work everyone's done behind the scenes as well as behind the fringes, I'd turn it over to Leslie to moderate the media. Thank you.
Thank you, Minister. We have 4 media registered for today's news conference who are joining by phone. There will be 2 rounds in the question and answer session, which will give each reporter the opportunity to ask 1 question and 1 follow-up per round. Our first questions are from Mark Quinn with CBC. Please go ahead.
Good afternoon. It seems that Ontario has started booking today, and they will be offering shots as soon as Thursday. It seems we're behind a little bit. Can you explain why it's taking a bit longer to start the program here in Newfoundland and Labrador?
The vaccine delivery is scheduled for Wednesday night, but could be Thursday morning, and the vaccine with a small holdback of 2,000 doses, which will go to the provincial depot, has to be distributed to the RHAs to allow that to happen. This is simply a timing issue from when the feds are delivering the vaccine. So that will be out there, and the 27th is go live date as far as vaccination is concerned, assuming weather doesn't interfere with the transport.
And as a follow-up, can you just repeat, some parents are asking me how they can book shots. Can you repeat about, I understand they're going to be receiving a letter, but also they can book for mass vaccination. Just to be clear, can we repeat that, please?
Certainly. There's choice here. Parents can wait for the school to be the site, and that will start as early as next week. And alternatively, if they wish, they can book through one of the mass vaccination clinics, and that can be done through the government webpage. And there's a big button on the top that says "Get the shot." Go down there, and you can fill that in. The important thing is that when the appropriate box populates, that you tick that it is a 5 to 11-year-old who is requiring vaccination. That way, the clinics can have the appropriate number of pediatric doses on hand. Again, we're very conscious that we had a wastage rate of vaccine with our adult program of a fraction of 1%, and we want to keep it that way with the children's vaccine too.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. The 14-day period where no one should have a vaccine before or after, have the vaccine before or after getting another vaccine. Can you just spell out specifically the risk there? Why people would wonder what could potentially happen?
Yeah, so there's not a risk with actually delivering the vaccines together. We've been delivering vaccines, the COVID vaccine and other vaccines at the same time or in closer proximity for quite some time now. But it's more just, when we have a new vaccine come in, we want to make sure that we are, if side effects do occur, that we know that they're related to that particular vaccine and there's not potential confusion with could it be one vaccine or the other. So that's the main reason. It's precautionary in that regard. It's part of the vaccine vigilance. I expect, much as it did with the adult vaccine, that as we have we start giving more vaccines. We see what's happening in the U.S. They've given millions of doses of children's vaccine at this point. Once we get more information in that regard, that recommendation will probably change much as it did with the adults. But at the moment, that's the recommendation from NACI, and it's really just more precautionary, just so we make sure that we're getting good information and that it's information that we can rely on.
Thank you. And there's a consensus or a thought out there that COVID is pretty mild for kids, comparatively so, and whether or not parents might think, well, do they really need to be vaccinated? What do you say to parents who are going to probably take a wait-and-see approach to this, given that it's the most recent and newest vaccine on the market?
Yes, and perhaps Dr. Bridger can speak to this in a minute, but I think, we know that for the most part, yes, this disease is mild in children, but there are some more severe disease that can happen. And, we've seen that in the United States earlier when they had a big rush of children, rise in children cases that, we had a lot of children end up in ICU. Just by the fact of sheer numbers, a certain proportion of people will get severe disease. So, we want to make sure we're protecting our childhood population as best we can. And there are some longer term effects that can happen from COVID-19 infection. And perhaps I'll leave that for Dr. Bridger to talk about a little bit.
Thank you. I agree with everything Dr. Fitzgerald has said about the potential for more severe disease, and certainly there have been some pediatric deaths. But outside of severe disease and ICU hospitalizations, there are a couple of longer-term things that could happen. One of these entities is called the multi-inflammatory system syndrome associated with COVID, or MISC-C. And this is a very rare condition, usually happening a few weeks after COVID infection. And in Canada, up until a few weeks ago, there have been almost 300 children admitted with this syndrome, and about just under half of those kids were in the 5 to 11 year age category. And while none of these children thankfully passed away, it was quite serious, and these kids did require medical interventions to get better. And then the other thing to consider is the emerging evidence around the post-COVID syndrome, and some people call it long COVID or long haul COVID. And there's more and more evidence coming out regarding long COVID in pediatrics. And while it doesn't seem to be as big of a problem in younger kids now as in older kids, the evidence is still emerging for this. And so, you've got teenagers, young adolescents who have symptoms for months after their COVID infection. So I guess this is a long way around saying that while most kids do have a mild disease, there is a possibility for some kids to have much more serious disease and much more long-term disability from it. So when one is thinking about the risks of vaccination versus the risks of infection, I think it's important to think about all the risks to your child.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Yeah, I'd like to talk briefly about the risk because of the media exposure and a lot of talk on the media. There's some uncertainty about this supposed risk of heart inflammation, myocarditis and pericarditis. What is the actual risk of that in children, and how serious is it?
So the risk, the evidence is still emerging, and, it's what we have found up to this point is that certainly down to, the risk seems to increase inversely with age. So it seems to affect younger males more than older. And so, that's something that we're watching out for, but what exactly this risk is in this age group, it's difficult for us to say at this point. But that is something that obviously that we're keeping a very close eye out for. Certainly, they're a couple weeks into their program in the United States. We're not seeing any major signals at this point, but it is still very early. So keeping a very close eye there. It does, I mean, this syndrome in and of itself, even outside of being related to vaccination, is rarer in the younger age group, and so that may factor into things as well, but a lot of the information we're still learning about.
Okay, thank you. And what should a parent whose child is about to turn 12, say in January or February, should they wait or should they just go ahead with the childhood dose?
Yeah, so my favorite question. We've always said that you should get the vaccine that is available to you, the earliest vaccine that is available to you. So we would recommend that any child who is eligible for the vaccine now receive the vaccine that they are eligible for. And once they turn 12, they can certainly get the higher dosage vaccine after they turn 12 for their second dose. There's NACI has indicated that that is okay. So, it's still a choice that parents can make, but we certainly recommend getting the first dose that's available to you.
Thank you.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi, and thank you. Staying on the topic of parents, what do you say to parents who may be hesitant or maybe nervous about getting their kids vaccinated?
I think, I think it's okay to ask questions, and it's okay to have concerns that you need to get answered. I think when you are going to get those answers, though, you need to make sure you're going to reputable sources that can provide the information that you need. What we know about this vaccine is that it has gone through Health Canada's rigorous approval process. They have found it to be safe, effective, and NACI has said it is safe, effective, and beneficial. And so we know that, when we're weighing risks and benefits, there's more to this than just the risk of COVID itself. There's the risk of school closures that come with outbreaks. And there's the risk to family members potentially if there's transmission from children into family members. So there's lots of reasons to consider vaccination, but we do know that this vaccine is safe and has passed all the same rigorous approval process that any other vaccine has.
Thank you. And I know that there's more details to come on what the vaccinations will look like in classrooms, but can you just walk us through a little bit about, a little bit about how that will look and how you'll decide which schools will have the vaccine clinics first?
That's a good question. The decision about which schools within a regional health authority will go first, as it were, is one that is taken by public health on the ground in discussion with the principals and the school districts. So it may well be that the larger schools may go first. It could well be in some of the smaller communities where they're going to make it a vaccination centre in the evening, that they'll start with the school children, as it were, in the afternoon and hang around for a more generalised clinic in the evening. So those are very operational. They will be rolled out over the course of the next few days. As I said, parents will get a letter today or tomorrow through their usual email channels from the school, and then next week they'll get a reminder which will give them links to the consent form that they will need to read and sign for their child to have the vaccine in school, if that's the option they choose to take.
Our next questions are from Mark Quinn with CBC. Please go ahead.
Thank you. Minister Haggie, can you say what the first letter will tell parents?
My understanding is the first letter, in actual fact, is under Dr. Fitzgerald's signature, explaining pretty well what she just said for the presentation earlier. It is so that all parents with eligible children are kind of on the same playing field as far as information is concerned.
Okay, so parents will receive letters saying that the shots will be given at school, and then they'll receive a second letter that will ask them or offer them links to give their consent. Is that correct?
That's my understanding as it stands at present, and there is always the option, if they choose not to wait till next week, of going to a mass vaccination clinic if one's conveniently situated.
Thank you.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thanks. We know that Pfizer has, they're experimenting, or at least coming close to developing an antiviral pill. And there is thought that, people might wait for the pill rather than having to get needles, especially those who have serious aversions to needles, like, kids especially, but we know adults as well. Is there, what's the discussion around the antiviral pill right now within the Department of Health?
Sorry. Go ahead, Minister. You go right ahead.
No, I was going to say, with mentioning the Department of Health, I kind of thought that might have been directed at me. Quite frankly, we would rely on the advice of folks such as Dr. Bridger about the utility of treatment. However, one of the whole shifts in emphasis around healthcare is around prevention. And the best prevention that's saved the most lives in the last several decades has been vaccination. Far better to avoid having something than have to rely on kind of rescue treatment. But I don't know whether Dr. Bridger has some more relevant comments in terms of utility of antivirals.
No, I just want to agree with you wholeheartedly on that one, Dr. Haggie. I think that vaccination is definitely the better way forward here than the antivirals. However, some of these antivirals that are coming out do look promising, but the reason they look promising in the unvaccinated is because the studies weren't able to find enough vaccinated people who would get that sick. So the vaccines work so well that they weren't even able to look at these antivirals in vaccinated individuals. So that's why these pills are being advertised for unvaccinated individuals. So I think that should underscore how well the vaccines work and how important they are in moving forward.
Thanks. And I just wanted to check on whether or not the recent cyber attack has had any causing any complications or issues whatsoever with the rollout of and I'm thinking accessing records and that sort of thing, especially when it comes to kids.
We're not aware of any. The software has been up and running. There was some manual entry of data, and there were elements. If you remember, the COVID tracker and the little gauge on the web page was offline for a little while. That was updated as of the weekend. But the records were intact and pristine, according to the information I have. And so we're in a good place to start with the children's vaccination.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Yes, I have a couple of timeline questions. You mentioned that all of the doses should be arriving by Friday. Does that also mean second doses, the whole kit and caboodle?
No, that means first doses. We're expecting, I think, just around 34,000 doses between now and the end of the week. That will, according to our MCP figures, be sufficient to get dose 1 for all the eligible children. Dose 2 will come, and the National Operations Centre in Ottawa is in discussions with our vaccine coordinators here about when we could expect that second shipment. We have a window of around 8 weeks before we would actually need that, but we anticipate the vaccine arriving well before that.
Okay, thank you. And a timeline question, perhaps Dr. Fitzgerald has already talked about this before, but by the end of March or so, we might be approaching the full vaccination for most children. What will that mean, do you think, for pandemic restrictions? Will it make a big difference?
Well, certainly what we know right now and what we're seeing elsewhere in the country, there's quite a lot of spread in this group of children who are unvaccinated. So having them vaccinated, having them have protection against infection and severe disease is very important, and I think it will certainly make a difference for our pandemic restrictions. I think, certainly it can help schools to get back to normal. If we have a successful campaign in this age group, if we can have the same types of results that we've had so far for those over 12, it will go very far to making sure that we're getting the majority of our population protected. And then for those kids under the age of 5, that will give a really great cocoon around them to help protect them until we can get vaccines for that age group as well.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi, and thank you. The question is for Dr. Fitzgerald, and you mentioned in your preamble earlier that this is the final hurdle in the COVID-19 marathon. Can you expand on that a little bit and just how exciting it is to maybe start that final hurdle?
Oh, gosh. Well, it's very exciting. When vaccines came in, that was really, really exciting. And then when the age group got expanded to include 12 to 15-year-olds, that was really, really exciting because, we were seeing spread in that age group. And now, the Delta variant, we always say Delta finds the unvaccinated. And so now we're seeing that this group of the population are where we're seeing the most cases or, a lot of cases. And so I think we're really, for us, this is in public health, this is sort of that last large group that we're going to have to vaccinate, where we're seeing, those children have to congregate, they have to come together, they have to go to school. And so I think this is, it really is, sort of helps us see that light at the end of the tunnel. Although I've said that before, and the tunnel feels like it has crashed down sometimes. So I don't know. I say it with caution and knocking on wood, but it really does feel like this is that last hurdle we have to get past.
Thank you. And my last question is just, we've talked a lot about how the pandemic has kind of affected adults, but how important is it for kids to have that light at the end of the tunnel and maybe get back to a sense of normalcy?
So I think it's really important. And what we've been hearing again and again is that while kids are not as severely affected by COVID-19, they have been more severely affected by the pandemic itself and, all those other things to do with the pandemic. So there's not being able to go to school, not being able to attend some of those activities that they normally attend, that socialization, which is so important for children, that being able to play in this age group is so important. And so we want to be able to give that back to them. We've tried very hard and we've done very well because we've protected the rest of our population so much that, that offers that extra protection for this age group right now. But we really want to be able to give them that extra protection too. And so there's also been a lot of anxiety with kids, and I think they've been anxious about the pandemic, but also about how the pandemic has affected them. And for children who have anxiety issues, it's heightened their anxiety. And so I think, again, this is a way to help reduce that for this age group. And so I think, positives all the way around.
Thank you.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, thanks, Leslie. I think this is another really important milestone, as Dr. Fitzgerald has highlighted. This is, nearly the final brick in the wall in our fight against COVID. The adults and or the eligible people currently, we've got 89.4% vaccinated. With our established pediatric track record for mumps and those kind of vaccinations, we are amongst the leaders in Canada in getting our kids vaccinated. We run between 94 and 98% on a regular basis. And I'm really excited to see this opportunity to see if we can beat even that figure for that age group. So, again, thank you everyone for your time, and I'd like to thank Dr. Bridger and Dr. Fitzgerald. Fitzgerald again for their efforts in getting this plan up and running. So with that, I will mimic Dr. Fitzgerald and say hold fast and stay safe. Thank you.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.